Everyone, hello. My name is Nathan Heatherly. I'm one of the admissions counselors here at Baylor University. Thank you so much for attending Spring Premiere 2022 for the Public Health Department. Ms. Shanks is going to be talking about a little bit about the department, kind of what classes look like, what that experience may look like for you. What we ask, if you have any questions, just put those in the Q&A, and then we'll try to get to those at the end of the presentation. Ms. Shanks, I'll let you introduce yourself, and we'll go from there.
Great, thank you so much. My name is Ms. Shanks. I am the undergraduate program director for the Department of Public Health. This is my 9th year teaching at Baylor, but I was also an undergrad and master's student at Baylor. So I bleed green and gold and I love Baylor. So if you have any questions about Baylor, even outside of our program, I'm happy to answer those for you. So today we're just going to talk a little bit about our program and really what public health might look like at Baylor University. And you'll get to meet a couple of us virtually. And so again, if you have questions along the way, please put them in the box and I will answer them either within the program or when we have time after my presentation. So we'll get started. Okay, so public health is a lot of things, and in some ways that can be intimidating. What do I want to do with this degree? What can I do with this degree? Well, there are 5 main areas of public health. Community health, which is what we specialize in. There's epidemiology, biostatistics, environmental health, and healthcare administration. But within each of those, there are lots of categories and topics. And so I often tell students, think about 2 things. What is the population you want to work with? And so that might look like some students are really interested in maternal and infant health. Others are interested in geriatric health. And so some people are really interested in adolescent health. So that is a great place to start. The other question is, what topics do you enjoy? So you do enjoy things like within environmental health, clean drinking water or air pollution. Within community health, are you interested in prevention? Are you interested in screenings and treatments? So all of those things fit under public health. And so there's, while it's really big and broad, there is a lot of space to make your own. So you will find something you're looking for in this field. So public health really focuses on 2 things. We're interested in the science of community, of helping people. We believe that people have a right to be healthy and live in conditions that support their health. So I always tell students, we're trying to make the healthy choice the easy choice for communities. And so while medicine might really focuses on individual health, right, the individual symptoms, the individual treatment plan, we're looking at a community. So how do we keep the entire community free of infection, or how do we create a safe environmental space for the entire community? So if you are community oriented, this is a great spot for you. I often tell people, I feel like public health is the social work of health. We're boots on the ground. We're at the lowest level of policy, all the way up to the highest level of policy. And so we can really be impactful. A lot of meaningful relationships can develop within communities. So if you are a people person, this is a great place for you as well. Another good thing about public health is, I mentioned kind of this tier. We can be effective, we can make impact at all levels. And so I ask students, what kind of impact do you want to make? There's no wrong answer here. So I'll start at the top. The top is the smallest impact on a community, but really the biggest impact on individuals. So this might be individual counseling, worksite wellness, coaching people on healthy diet and exercise. And that person will be impacted because it's a one-on-one. And so if you like that one-on-one mentorship, counseling, you can make impact on that person, but it will make less of an impact on the community. But as we go down this pyramid, you're going to start increasing your impact on the community. So the green one is clinical interventions. So these are things like vaccine availabilities, medicine, high blood pressure checks, diabetes, glucose checks. And so that is clinical and that helps people, but also helps communities, because if we can control some of these larger health concerns, then that's going to help the community. And we'll go, as we go down, the blue is things like intervention. So smoking cessation interventions, colonoscopy, screenings, vaccines. And then as we go even further, we're talking about policies. So things like smoke-free laws, right? We know that may not affect one person, but it's going to affect a lot of people. And so you're making a larger impact on the community. And the last one is perhaps the most difficult to affect, but obviously makes the biggest impact, is looking at socioeconomic factors. So things that affect health that aren't clinical intervention. So things like poverty, education levels, housing disparities, really systemic issues that will require a lot of time and resources. But if you're interested in policy, this is a great place to be for that. This is a great level to focus on, and that impact will impact perhaps your whole city, right? If you pass a city ordinance, or maybe a state law, or a national policy. So again, large impact on community. There's space for us anywhere on this. I honestly prefer to work within the yellow. I love interacting with clients one-on-one. And so great, I get to do that. I'm going to leave the policy up to people who really enjoy that process. So you can fit anywhere in this space. I'm going to go ahead and show you this video from our associate chair, Dr. Lanning. She has a very unique research and life, and she wants to say hello.
My name is Dr. Lanning, and I'm the Associate Chair of the Department of Public Health at Baylor University. I want to tell you a little bit about public health. And public health is really a very eclectic type of a profession, which means that we look at a lot of different things. So when I'm in a barn, which doesn't seem like a natural place to be talking about this, I'm not in the office or I'm not in my classroom. Our classroom in public health is all over the place. It's really about looking at health from a macro perspective. So we look at health from a community perspective. We think about what is that person doing in their community, their physical health, their emotional health, their environmental health, their social health is important. Also, how it impacts the healthcare system, the resources that are available in our healthcare system, the resources available in our community, their connection between human health, environmental health, and animal health. That's one of the reasons why I've got Carol Jean right here with us. So our professionals, public health professionals, work in a lot of different areas. We're working with the UN. They may be working with the CDC. We have health professionals in all different aspects of everyday organizations and entities that work that are connected to health. So it's a huge field. And the public health program at Baylor will help train you to work in those different areas, in those different arenas of health and healthcare. We have a lot to offer, and the outlook for jobs is extremely strong. You can go a lot of different directions with the degree that you'll get from Baylor. So we're excited that you are looking at this video, and I hope you think about public health as a major. Carol Jean would love to have more of you in her life too as well. So if you have more questions, be sure to reach out to us. We're here to help you. Thank you.
Okay. So Dr. Lanning is the associate chair, but she has some interesting research. She does equine therapy, and so she has lots of horses involved. Students love Carol Jean. So this is a summary pretty much of what she said, what public health specialists are trained to do. We really work in conjunction with a lot of other disciplines, and so it's not uncommon for us to work with social workers, educators, administrators, businesses, to really think about the big picture of health within the community, whether that is a business community or a neighborhood community or a city community. And so we think about systems thinking a lot. How do we affect a system, change a system so that it provides equal opportunity in health for everyone involved. The places that our students are working are really varied. We find most of our students are going into government work or nonprofit organizations. So government work would be something like local public health districts, health departments, or the World Health Organization, the CDC, NIH, but also nonprofits. So those smaller community specific organizations. I want to tell you a little bit about our program specifically and what I find to be very, my favorite things about it. And so there may be another video coming up if it will participate. We might get this to work.
My name is Margo Shanks. I'm a senior lecturer in the Department of Public Health. I also serve as the undergraduate program director and the internship coordinator. The Department of Public Health is housed in the center of campus. With students coming from around the world, we hope that they find themselves home here at Baylor and our program. It is very important to us that we create a community both in and out of the classroom. One of the ways we do this is that we have small class sizes. This allows for us as instructors to get to know our students on a one-to-one basis, not only who they are and what their names are, but what their passions are. We have also adopted a cohort model. In this model, students go through a series of core classes together. This model is great, not only for classroom instruction and discussion, but it often leads to strong relationships among classmates. It's one of my greatest pleasures to see those relationships form throughout the year. Not only are we intentional about our classroom communities, we're also very passionate about the communities we serve. Many of our assignments, projects, and experiences often include partnerships with local organizations. Our Intro to Public Health course provides an opportunity for students to be in the community in their first semester as a major. Our students are tasked with creating the health fair for a local nonprofit called Church Under the Bridge. Students are responsible for creation of various educational booths, and many students have reported that this is their favorite experience of the whole program. Being in the Waco community is a high priority for us. You can find us working with the Family Health Center, the Waco-McLennan County Public Health District, and many other nonprofits in the community. Because of these relationships, we're often able to place students in these community settings for projects, assignments, internships, and practicums. And though we love our Waco community, we are aware that the public health field often has communities domestically and globally. Our faculty are involved in research, projects, and education throughout the world. While some are speaking at the UN, others are doing research in Africa. You can find our study abroad program in Brazil every summer, or you can join us on a mission trip to the Dominican Republic or Africa.
The information that happens, that the people give out, and especially for the girls here and the guys, they're all really friendly, very helpful. I haven't met someone who's certainly aware. Everyone's wanting you to come to their booth and stuff. That's what I like about it.
See what's going on, see what's giving back to the community.
Yeah.
See what the young crowd, the young nation is doing towards not only fulfilling their achievement in life, but just to see the joy and happiness and what y'all bring to help the community in life.
The one word I would use is the word that I love that they use in Harry Potter. Really, overjoyed.
I think it's pretty awesome. The word that I would use to describe this experience is gratifying.
Surprising. Eye-opening.
Positive, different.
Completely warmed me
With a faculty with diverse interests and research areas, this provides students an opportunity to connect with professors who have similar interests. We also encourage students to get involved with student organizations on campus and within our department.
Okay, sometimes it's easier to explain how much we love something and how much something is valued by inserting our videos and pictures. So this is a brief program description. We described kind of what a classroom setting might look like. They're very small class sizes. But we have an undergraduate degree, master's in public health degree, and a very interesting joint degree. And that's a 5-year program. In 5 years, you cross the stage and you get both degrees. You get an undergraduate, a BSPH, and an MPH. This is beneficial for many reasons, but obviously, if you are applying to a job out of that program or a professional school like medical school or PT school, you're applying with a master's degree, which gives you a leg up. And so that program is has to be declared by your sophomore year, but we have plenty of time to talk about that opportunity and some of the financial benefits that might come with that as well. So something really to consider if you were planning to get a master's degree anyways, or if you're planning to go into a health graduate field. One way to keep in touch is to follow us on Instagram and Facebook at Baylor Public Health. And we give updates, student spotlights. This week is National Public Health Week, and so we have a campaign for National Public Health Week going on through Instagram right now. But you can always email me or call. Another place to explore, if you haven't already, is our website, baylor.edu/public health, and you will find more information about our degree plans, including that 5-year plan. So I know I'm going just over time, but I would love to take any questions that you have. I have a question that was posed about a career path in this major. One of the things we do pretty early on in our first semester is explore the 5 areas of public health. And so we can help you identify, maybe not right away which one you do want to do, but there will be a way to say, these are the ones I don't want to do. And we continue to narrow that focus all the way up into your senior year. There's an internship your last semester, and by then we're hoping that you have discovered the populations or path that you want to take, but the faculty will help guide you into that direction. Okay, so with the master's degree, that will also provide you the opportunity to go forward in any school and any further schooling, but also when you're applying to jobs, that any position that is open to all public health majors or graduates, a master's degree will certainly stand out above a bachelor's degree. Master's degrees tend to be more narrowed. So you'll want to find a master's degree that fits into what you're interested in. So for instance, we have a concentration in master's degree, public health, environmental health. We have a master's degree with a concentration in community health and epidemiology. So you'll want to narrow your focus based on what you're interested in, and then really become a specialist in that area. Prerequisites for transfer students, I don't know that I could speak completely to that, but for our major, we do not. We have a core set of classes. You can find those on our website. Those probably won't transfer in, but all of our general studies tend to transfer in pretty well, and an advisor would be able to help you with that.
Yeah, and something important to know as well with transferring in, if you've got credits from another institution, the Baylor equivalent course tool is probably a great way you can actually put in the institution you took your classes at, the class number and subject, and it'll actually tell you if it'll automatically transfer into Baylor. It is a database, so it is limited, so you can submit a course request if those are not in that database ahead of time as well. Any other questions? Don't see any others. Give it a minute or two. Ms. Shanks, thank you so much. So helpful, and what a great major, because you do get to affect so many people's lives, whether that is, personally or kind of broadly. So thank you so much. If you guys need anything else, please feel free to reach back out to us. We're always happy to help. These videos should be posted on the admissions website in about a week. But if you guys need anything else, just let us know. Thank you so much, Ms. Shanks. Y'all have a good day.